Afternoon, everybody. Today is the 3rd of August, roughly 5:30 p.m. Sitting here, and after watching the news, I thought I'd do another topic, but today I'm going to stay away from anything with shootings or trauma. I'm going to deal with the animal stuff that we talked about. So you're going to have to bear with me. I have a lot of notes on different things, and hopefully this will help some of you. We talked about rabies. Remember, with rabies, once the symptoms develop, it's normally fatal. It's a neurological or nervous system type event, causes brain cell malfunction. Pass through an infected animal saliva, and the incubation period in humans is about 2 to 12 weeks, I think, upwards of 2 months, if I understand my notes right. Symptoms in human could be fever, depression, agitation, painful spasms followed by excessive saliva, death within a week without a vaccine. Treatment is hospitalization, immune globulin injections, and anti-rabies vaccines. The rabies vaccines, I think that's the one, it's 12 or 13 shots they give in the stomach. In the U.S., typically 0 to 5 deaths are reported on these type of events. Death by lightning is more likely than before rabies. Animals that don't get rabies is typically reptiles and birds. The domestic, most common to be diagnosed, are cat, dog, horse, mule, sheep, and goat, it looks like, that I wrote here. Wild animals, the most common are your bats, raccoons, skunks, and foxes are some of the most common. Talked about distemper also. Humans can get the virus, but typically no effects or not major concerns for U.S. us in the U.S. as humans. Canine effects can be respiratory, GI, central nervous system, plus conjunctional membranes of the eye. First signs of distemper would be sneezing, coughing, thick mucus from the eyes and nose, fever, stunning, vomiting, diarrhea, depression, loss of appetite, and lethargy. Passed by direct contact, typically with the urine, blood, or saliva. So distemper, they say normally are not a major issue for us. Sorry about that. I had to go enter my phone. Just for animal sake, a wolf size, fully grown, about 32 inches by 110 pounds. The bite force on the wolf is about 1,500 pounds per square inch. When we look at coyotes, full grown 26 inches to 55 pounds. Prints are about 2.5 inches in length. The bite force is equivalent of a medium-sized dog when we look at the bite force. With the wolf, they have about a 5-inch in length print, approximately. Dog puncture wounds. Since we're getting into that, animal saliva, including dogs, contain millions of bacteria. Hygiene is one of the most important things in caring for bite wounds. Wounds with children, typically you're going to see those wounds on the head, arms, and legs, most common areas. With adults, it's going to be arms and legs. Scratches result of the dog's teeth striking on the skin, normally minor and not major bleeding. Deep open cuts, normally deep and may bleed. Severe cut wound caused by dogs result in jagged skin edges. Puncture wounds, the most common result caused by teeth penetration on the skin and usually deep. May damage not only the dermis but also may damage not only the epidermis but also dermis and into the inner tissue. Drainage and puncture wounds are common. This wound traps bacteria and viruses. The treatment is within 8 hours of the injury. Clean the wound immediately. Irrigate puncture wounds with clean water and gentle soap. Saline solution are also recommended for irrigation, as this is a natural antibacterial stuff. Remove any debris, dirt in the wound. Apply antibiotic ointment and bandage the wound. And a lot of times they recommend antibiotics for these type of treatments due to the bacterial issues. Another one that you asked about was removing quails from a person. The biggest thing there is without pain medication. This is going to be very tough, but I'll describe what you're supposed to do. You ask the patient to remain calm and still and remove the quills as soon as possible after the incident occurs. Never cut the quails before removal, as it can make the quail harder to grasp and could break apart into several splinters. You will need flathead pliers or hemostats to remove the quails. They have barbed ends along their surface, which makes them easy to stick in to but hard to remove from the skin. Use a powerful, rapid motion to remove the quail. Don't twist, which could cause breakage. And then disinfect the wound and apply antibiotics. Another thing that we were talking about the one day was chigger bites. It in the juvenile form of the species of a mite that belongs to the I'm going to spell it because I can't pronunciate it. Trombiculae family. They attach themselves to human and feed on the skin cells, which can lead to itching. Chiggers are very small and almost impossible to see without a magnifying glass. 1/50th of an inch in size, red in color, tend to cluster in groups on a person's skin, and that's typically when they're visible because they're in a group. There's a bunch of them together, so you can see them easier. Most common in the spring and fall months, found in warmer southern and midwestern states. Treatment would be over-the-counter anti-itch meds. Ice might relieve some of that itching, bath, and or shower. Takes about a week to heal from this type of exposure. How about some of the symptoms that you may see? Reddish welts within 24 hours of being bitten, followed by intense itching. These bumps resemble blisters, hives, welts, and pimples, and tend to appear in groups, often grow in size over the next 7 days. Chigger bites do not burrow into the skin, carry disease, or feed on the blood. They do feed on human skin cells. Only the juvenile mites will do that. They will insert their feeding structure into the skin. They inject an enzyme into the skin to liquefy the tissue. This action makes a hole in the skin, and then the skin around it hardens, forming a feeding tube for the chiggers. So hopefully that was some useful information on some of the animal bites and dealing with certain things out there, the chiggers, the distemper stuff. like I said, this is reference material. I am not a doctor. I'm just trying to pass along information that I know. So, as in anything in a real world current event, like nowadays, I would immediately seek medical attention with your family doctor, going to the hospital, whatever. In a grid down, that may not be an option, or during a disaster event. But remember this: if you're going to deal with animals, animals that, you know, your family pet, whatever, if they are wounded, you need to, especially with dogs, you need to put a muzzle on them, because when they're injured, they have a tendency, they will bite. So you want to protect yourself and also protect the people that are rendering aid. So any animal that's injured is going to be very defensive. So things to think about when you're out there. Hopefully this is good information. This is Rescue Boss. I'll be signing out. Have a great day. Be safe. And until my next video.